Nasopharyngeal cancer. Overview. Nasopharyngeal cancer, also known as NPC, is a relatively rare malignant tumor that begins in the epithelial cells of the nasopharynx. The nasopharynx is a narrow space located at the back of the nose and above the soft palate, the rear portion of the roof of the mouth. The nasopharynx is also very close to the nerves that come from the brain to the eyes, face, and tongue. Nasopharyngeal carcinoma is more common in Southeast Asia, particularly in southern China, Hong Kong, Taiwan, and Singapore. This type of cancer commonly affects males and tends to be diagnosed in adults aged between 30 and 50. Classification. Nasopharyngeal cancer is classified by the type of cell affected. According to the World Health Organization, NPC is classified into 3 subtypes. Type 1, keratinizing squamous cell carcinoma. It is the most common subtype, accounting for approximately 60 to 70% of cases. Cancer cells produce keratin, a protein found in skin and hair. This cancer subtype generally has a poorer prognosis due to its aggressive nature and lower response to radiation therapy. Type 2, non-keratinizing carcinoma constitutes around 20% of NPC cases. It has a better prognosis than keratinizing squamous cell carcinoma due to its higher sensitivity to radiation therapy. Type 3, basaloid squamous cell carcinoma. It is a rare subtype that accounts for 10 to 20% of cases. It is known for its aggressive nature. Causes and risk factors. Chronic Epstein-Barr virus infection significantly increases the likelihood of nasopharyngeal cancer developing, particularly the non-keratinizing subtypes. Genetic susceptibility with a family history of NPC dramatically raises the risk, with first-degree relatives having a 4 to 10 times higher chance of developing the illness. Consuming salt-cured fish and meats, which contain cancer-causing nitrosamines, are linked to a 2 to 3 times higher risk of nasopharyngeal cancer. Exposure to specific chemicals and pollutants, such as formaldehyde and wood dust, has been linked to a potential 20% increase in NPC risk. Smoking and excessive alcohol consumption can increase the risk of NPC, although it is not as strongly linked to this type of cancer compared to other head and neck cancers. Staging. Nasopharyngeal cancer staging is based on the tumor's size, location, and the extent of its spread. Stage 0. Cancer is limited to the top layer of cells in the nasopharynx. Stage 1. The tumor has extended to nearby structures, such as the back of the throat or the nasal cavity. Stage 2. Cancer has spread to 1 or more lymph nodes on one side of the neck. Stage 3. Cancer has spread to lymph nodes on both sides of the neck. Stage 4. The tumor has spread to the skull, eye, cranial nerves, salivary glands, or lower part of the throat. It may also have metastasized to distant areas like the lungs or liver. Symptoms. It's often challenging to detect nasopharyngeal cancer early because its symptoms often resemble less severe conditions and may not appear until advanced stages. Most people with nasopharyngeal cancer notice 1 or more painless lumps on the back of their neck. These lumps form when the cancer spreads to the neck's lymph nodes. Other symptoms may include nasal issues such as nasal congestion, nosebleeds, and postnasal drip. Ear problems including hearing loss, tinnitus, and ear infections caused by eustachian tube blockage. Nervous system symptoms like headaches, facial numbness, and cranial nerve issues if the tumor spreads to the skull base. Patients with nasopharyngeal carcinoma may also experience fatigue, weight loss, and night sweats. Diagnosis. If your healthcare provider suspects nasopharyngeal cancer, they will ask about your family history and perform a physical exam, checking your nasopharynx, head, neck, mouth, throat, nose, facial muscles, and lymph nodes. Conduct blood tests, including Epstein-Barr virus antibody screening, and thyroid function tests to assess thyroid status before potential radiation therapy. Perform an endoscopic evaluation called a nasopharyngoscopy to visualize the nasopharynx and collect tissue samples for biopsy to determine the cancer subtype. Use imaging tests like MRI, CT scan, or PET scan to locate the primary tumor and check for cancer spread. Test results help stage the cancer, plan treatment, and estimate prognosis. Treatment. Radiation therapy is the main approach for treating nasopharyngeal cancer. Intensity-modulated radiation therapy, IMRT, is the preferred option because of its precise targeting of the tumor while minimizing damage to healthy tissue. Nasopharyngeal cancer is treated in hundreds of clinics worldwide using various approaches and equipment. However, not everyone knows that the cost of treatment in different countries can vary widely, even with the same high level of quality. For example, intensity-modulated radiation therapy or cervical lymphadenectomy can cost twice as much in the Netherlands and Thailand as in Serbia and Poland, but half as much as in Israel and Germany. In order to find the appropriate treatment conditions in advanced clinics around the world, we created the Doctor.Global service. The platform is designed to help people get a second or third opinion, choose the best clinic location, or find the right cost and treatment date. We act as an involved mediator, helping to obtain comprehensive information from clinics, translating and organizing the patient's medical records in any language, and enabling the patient to make a meaningful choice of clinic or doctor. Follow the QR code link and describe your case. We will contact you back for confirmation and immediately start searching for treatment options, considering all your wishes. Nothing is more valuable and important to us than your health. Now, back to the treatment. Concurrent chemoradiation is an option for patients who are not eligible for surgery or have remaining disease after initial radiotherapy. Cisplatin-based chemotherapy is frequently combined with radiation. The inclusion of chemotherapy enhances both overall survival and disease-free survival rates. Chemotherapy, followed by chemoradiation, is used to shrink the tumor and improve progression-free survival in advanced cancer cases. Surgery is not a first-line treatment. Endoscopic surgery of the nasopharynx or neck dissection can be performed in case of metastatic or recurrent nasopharyngeal cancer. Immunotherapy and targeted therapy may be options for advanced nasopharyngeal cancer. Prognosis. According to the National Cancer Institute, 5-year relative survival for patients with stage 1 NPC is 88%, whereas regional spreading decreases this number to 70% in stage 2 and 60% in stage 3. Finally, stage 4 with distant metastases accounts for about 38% of the survival rate 5 years after diagnosis. Hope you've learned something useful today. Do not forget to like this video and share with your friends. We sincerely wish good health and success to all of you.